Well, we are talking about the power of light tonight, especially how it can benefit seniors who are battling depression or even dementia. It's tonight's For Your Health.
Full spectrum light, it turns out, has some healing properties, and it's being used on patients at American senior communities who are battling the ups and downs of dementia.
For whatever reason, we're not always quite sure why, some individuals with some types of dementia will get a spike of energy. They may experience some additional anxiety. They may begin to act in what we call a perseverative fashion, meaning that they will begin to get stuck on an idea or a thought or a phrase, or some people will just begin to move.
The light soothes those ups and downs. Melanie Perry, who is in charge of memory care support services, uses Verilux lights on her patients because it most closely resembles sunlight.
If we think about when we went back to grade school and learned that little acronym of Roy G. Biv, all of those colors of the spectrum are represented by this light. Basically what that does is to provide a more realistic perspective of light for the person who is perceiving it with their eyes.
And patients don't stare into the light itself. It's enough to be near it.
So they sit a little off to the side. It's more of an ambient exposure or an indirect exposure to the light, but as long as it's within their visual field and they are experiencing that type of even indirect exposure, 20 to 30 minutes a day, research tells us that can have a very helpful effect.
Full spectrum lighting isn't a cure, but if it can help, it's certainly worth a try.
And by the way, light therapy has been used on people with seasonal affective disorder for some time.